Good morning, and thank you for joining Mitchell County Hospital District this morning for our episode of Ask the Experts. This is Jessica Stone, Community Relations Director, and joining me this morning is Dr. Dee Roach, Chief of Staff, and Jennifer Hale, Director of Infection Control. Jennifer, I know the hospital recently purchased a new machine that is able to clean rooms. Can you explain how it works?
Yes, the ultraviolet machine that we purchased, it's called the RD-UVC, which stands for Rapid Disinfection Ultraviolet C. There's different types of ultraviolet lights. We're more familiar with A and B, but C is one that can do that disinfection. It can kill viruses, it can kill bacteria, it can kill spores. So the hospital, wanting to be forward thinking on our disinfection process, purchased one of those earlier this year. We also made that decision to purchase a second unit once we realized that the necessity of it during these times. And we also purchased a third unit for the nursing home. So the hospital has 2 units on hand and the nursing home has 1. Staff's been trained how to use that. This is not used as a substitution for regular cleaning methods. Regular cleaning methods are continued with disinfections that we've been using all along, and then this is like a third layer of protection, second layer of protection to disinfect and make sure the rooms that patients go in, or if we've had a specific kind of illness in the room, then we can zap that room. That's the term we use a lot, is zap it, and disinfect it so that it's free of viruses and spores and bacteria.
Great, thank you. And Dr. Roach, what do you think the outlook is for our community in the upcoming months?
So we've seen an increase in the number of cases through the nation and state, and even here locally we have seen a slight uptrend in the number of positive cases that we've been identifying. The challenge, of course, upcoming is that we're about to get into the cold and flu season in the fairly near future. We'll be seeing a lot of seasonal illnesses, including allergies, and of course all these things present with very similar symptoms to what you might expect with coronavirus or COVID-19. This represents a real challenge for us going forward in being able to discern or identify those who are at greater risk for COVID versus those who are having normal seasonal problems. One encouraging thing that we have, and really looking forward to this and excited about it, we have in the process ordered 2 new machines for our lab. One is to specifically identify the coronavirus. It's about a 45-minute turnaround time, and so we will have that available to us hopefully in the fairly near future. The second machine I think is even more exciting. It actually detects viral infections, including coronavirus, but it can run a full panel of different pathogens, not just with the respiratory tract, but also with the digestive tract. And so we will be able to then identify exactly the specific pathogen that's causing the problems. And so instead of just telling the patient, yes, you do have COVID, no, you don't have COVID, we'll then have the opportunity to say, you actually have fill in the blank, whatever it might be, which will help us in determining how to manage it if it were COVID, and also how to manage it more specifically it were the other pathogens that specific therapy would be indicated for. So these things are really exciting for us, and we're anxious to get those online. I do think it's going to make a tremendous difference and certainly help us clinically when we see these patients with rather nonspecific respiratory symptoms.
Awesome. I think that'll be wonderful for the hospital. Thank you for joining us this morning.
Thank you.